Okay.
D1.
Yeah, go ahead. Straight to D1. We have a young 47-year-old. आवाज आ रही है?
हाँ जी आ रही है.
Khalid, we have a 47-year-old lady who presented with obstructive jaundice, had an ERCP, got a stent in C2. She has a CA199 of 600 plus, and she has a mass on CT scan, the distal end of the CBD, query pancreas.
Okay. Thank you.
So we are basically going to evaluate the distal end or the head of the pancreas, and probably do an FNA if necessary because she is very young. There is nothing else. CT में बेटा doc.
सर उन्होंने सीडी दिया है टॉपिक पैंक्रियाज मल्टीपल कैलकुला विदाउट क्रोनिक पैंक्रियाटाइटिस सीबीडी स्ट्रैंडिंग स्मॉल कैलकुलस बस इन्होंने ये दिया
आपको नहीं दिया.
सर इन्होंने तो एविट में उन्होंने कहा है कि सर स्ट्रक्चर है नहीं एकदम से.
Okay, sorry Khalid, the CT scan is actually, that was the next door patient. It shows chronic pancreatitis with atrophic distal pancreas, dilated channels, but no evidence of mass.
No evidence of this.
Yeah.
Okay. ठीक है.
So where are we? So देखें थोड़ा सा, you can use the small wheel sometimes to get in. So when you get stuck, yeah, here, just use the small wheel a little bit. नहीं टाइट हो रहा. ओके, फुल बैक कर लें थोड़ा सा, फिर देखिए एक दफ़ा. ट्राई करें. या थोड़ा सा स्मॉल व्हील यूज करें. नहीं
याद हो गया सारा कुछ. याद हो गया सारा.
ओके, आप देखेंगे. एक ट्राई करें.
सही बात है. अब मैं वर्ड्स कैसे चेंज करूँगा?
दिखाना ज़रा. Okay, so we have, there's a large lymph node there, and we've got this is a mass. That's not a lymph node. I'm sorry. That's the CBD. Ooh, is that?
साद भाई,
Yeah.
ये स्क्रीन के ऊपर ना आपको वो ग्रीन एरो नजर आ रहा है EUS के ऊपर इमेज पे, जहाँ पे नंबरिंग है 2, 4, 6.
Yeah.
इस एरो को ना 4 तक ले आए. कैन यू?
ओह अच्छा, इन्होंने किसी ने इसको चेंज किया.
हाँ जी, दिस इज गुड. दिस इज गुड राइट देयर. तो मैं आई वाज डूइंग द अदर वन एंड somebody objected to that it was at 5 or 6. So I know we can see that, but I think the projection on the screen becomes a problem when it's not optimally focused.
So we've got a mass here, but I can't get in deep into through the pylorus. So there's,
And that also indicates that there is something really wrong there.
yeah. So in such cases, normally we would just do an FNA or FNB here, and then and that's it, because that's what we want in this patient otherwise. But for the, let me see if I can you see the stent now? While I'm here, I will try and see whatever I can see from as close to the pylorus as I can. That's the CBD there. You can see a bit of debris going up towards the liver. Coming down here, you can see the stent, and you can see the CBD all the way to this area. What I am not sure is what is this? Doppler, please. So this is Khalid. हटा दो Doppler.
Yeah.
You
Yeah.
see this?
Do you think it's a thrombus?
Yes, that's what I'm thinking. But it's completely occluded, this portal vein.
Yeah. And
But
what
like
is
it's-
above that? Is that a bile duct or a
That's not bile duct. This is a smaller vessel,
Yeah.
but this is not bile duct for sure.
Can you put a Doppler on that?
I will. Just one
yeah.
second. Bile duct is just above if you see the stent there.
Yes. We
Can
do
you see the
that.
stent there? Yeah.
Yeah.
So this is a vessel there, and this vessel, when I try and follow,
I think
Again-
it's a thrombus. That's what it
this
looks
is
like.
this is what when I first saw, I thought this was a really a lymph node, but then
We thought the same thing too,
yeah,
but
you know,
when you
this-
moved
when
around,
I,
it
when
looked like
I,
a
when
thrombus.
I when I saw it like, but this is a vessel, and where it is, it's almost certainly portal vein. I don't know. What do you think?
That's what it looks like.
Yeah. So this is bad news.
No, absolutely.
I'm not sure. Again, whether it's worth. So we are actually. You remember yesterday you were telling me. So I've actually done this examination from just pylorus.
Yes.
I could not peep into it properly, and I don't want to advance too much, because if you look at this, Khalid, the duodenal wall itself,
and
that area, it's all, to me, it doesn't, it's all infiltrated. You
it
see that
is.
it's thickened, infiltrated, and
Definitely it is. And also, there is when you're trying to go into pylorus, there is some bleeding, there is a
yeah,
thickness.
so
and
there's thickness, and so I'm not.
Yeah, so I don't
what-
think there is a
no,
need to
I'm
go
not
in
going
there.
to go there. I'm just debating at whether to do an FNA or not here, FNB, FNA, whatever. What do you say?
I think you can do the FNA from the pylorus area after getting into the good
So we'll
position.
just give Mansoor a few minutes to look at the stomach. This patient has been delayed by the time she has been referred to us, because this stent was placed in October. So I assume that when they so now you bring the liver. So let's focus on what we are going to do. So tip up. Yeah, tip should be up. Okay. And where are we? Yeah. So liver आ गया. ठीक है. अब थोड़ा सा
Saad bhai,
जी.
do we have hepatic meds?
We are just going to have a look, Bhabhi. I've just for now I'm just focusing on getting him to the aorta, but we'll have a look at the liver as well.
Okay, thank
But
you.
I'm sure you may have spotted something that I've not.
Yes, so there are actually.
When you asked me that question, I knew there must be some there. Wait a minute. Okay, rotate slowly. Clockwise, doesn't matter. We are looking at the liver, so you're just following. There, can you see that?
Which one?
Let me put some flow here. Can you see that lesion there? Is that what you were talking about? और थोड़ा सा rotate करो. 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 लिवर को देखते जाए. पूरा लिवर को आप एक रोटेशन में स्कैन
Yeah,
कर
यहाँ
सकते
पे साथ में basically there are small target
हैं. Yeah,
lesions.
there are small target lesions. I saw one of them. Yeah.
जी, so there are multiple.
And there is, I don't
Now
know
you
whether
can
this
see.
is, wait a minute, just
So
let me
now
see.
you
There
can
is this
see.
thrombus there? No, this is obviously dilated ducts with some debris in it. So if you want to scan the liver, you keep rotating yourself, keep rotating, keep rotating, keep rotating, keep rotating, keep rotating, keep rotating, and your hands going down, 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 down. You've gone all the way. Now you can actually do the same thing again slowly, and so you should be able to see if there is anything there. Certainly you can see debris in the ductal system. Ductal system is dilated. There is at least one area that I saw. There are more there. There, can you see that? I don't know if you can see that clearly. There's that shadowing. अब जाते रहो इसी तरफ, जाते रहो जाते रहो जाते रहो जाते रहो जाते रहो, ठीक है, all the way हो गया. लेकिन अब आपका tip up है.
जी.
Okay, now again do it. चलो एंटी क्लॉक जाओ. हाँ एंटी क्लॉक जाओ.
ये तो हार्ड आ गया तो
थोड़ा सा आगे जाओ.
आगे
हाँ थोड़ा अंदर जाओ. टिप अप करो एंड रोटेट करो. ये तो तुम मेरे साथ कर चुके हो यार.
नहीं जो यही तो कर मैं मेरे साथ
जाओ
से तो मैं
आयोटो. जाते तो जाते तो जाते जाते तो जाते जाते. यू शुड कम यार. ये आ गया. सो दैट्स योर celiac take off above. ठीक है. Now you just advance your scope a little bit. बस जी. तो उनको ले लो आंटी को फौरन.
ये पेंगुइनिटी
Possibly. No. So we go back. We won't waste time. We will go back to something that we understand. So if you're not sure, we go back and try and find the aorta. So let me show you एक चीज़ दिखाता हूँ. ठीक है. आपने ये पकड़ा है ना इसको.
मैं
ठीक है.
वॉल से अलग हूँ.
ठीक है. आप एक तो एयर निकालें. ठीक है ना. एयर निकालने के बाद we are here, right?
राइट.
ठीक है. Come back here. This is why you're getting stuck. See there, can you see the shadowing there?
See the shadowing.
Calcification. आप लोगों को नजर आ रही है ना?
बिल्कुल जी बिल्कुल.
So we've got pancreas here, right? Now once I've got this pancreas here, I'm going to just keep it in the middle and go whichever way then I want to go. There's definitely chronic pancreatitis here. इसमें तो there is no question now because you've got once you've got such bad pancreatitis, you really can't see anything. Pancreas का. Let me see if we can see the kidney here. Where is the aorta? मैंने आपको निकाल. There's the aorta. ठीक है. That's the aorta there.
जी.
So now we're not going to let it go away. We follow the aorta.
जी.
We've got the celiac takeoff. We've got the superior mesenteric takeoff. We follow the celiac. Okay. I'm just gently letting the big wheel away a little bit, going in. And you have complete atrophy of the tail, so you're not seeing any tail. The thing that you normally see here, we are not going to see. There are some varices, I think.
इसीलिए
See, these are varices there, and this is probably from the pancreatitis she's had.
कैवेंडस malformation की वजह से.
Oh, yeah, most likely because she must have had. So there's no tail there at all. And when we hit this structure here, this is all calcified pancreas. So really, I
body
can't
है.
see the duct.
Body another.
Yeah, this should be the body. There are so many varices here. Can you appreciate that? I don't know. So
तो इसमें वो
Can you
जो
see
dust का
kidney?
pattern बनता है वो.
let's see if we can see the kidney here. It's actually slipping off. This is.
सर यहाँ पे इनके पीढ़ी नजर आती है.
Here I'm just trying to see the PD, but I'm not sure because everything here is a vessel. See that? These are all varices there.
Yes.
And you have this area, there's no, even the CT said there was no pancreatic tail at all. And you can't see anything in the pancreatic tail area except for this calcified area. I don't see anything else. And from here, when I try and move my scope, we slip off because I'm pretty sure there is some kind of a mass effect here in the stomach as well. And I'm not surprised because the pylorus is non-negotiable and the tumor looks pretty. Right. So we'll just go ahead and do the FNB or A, whatever they give me.
22 gauge, sir?
Huh?
22 gauge FNB?
22, please.
जी. The size?
Could this be a unlikely? This is not inflammatory. Lots of varices here as well. So this is the area where I'll be. This is the area that I'm going to be targeting. Riyaz, can you hear me?
Yes, I can hear you, but yes, it is hyperquick.
This is the only abnormal.
Yeah, that's the only abnormal area.
Yeah,
that
and you
one
see the
can see.
CBD coming down from there. That's the stent there.
Yeah, that's
comes
right.
here and then you lose it.
That's right.
So this is, to me, this is the area really, and I can't see anything else. And so it's pretty hypoechoic, looks abnormal, and it's at the right place.
Yeah, that's right.
Agree or
it's at the
disagree?
right place.
Do you agree?
सर सवाल है कि इसकी पीडी क्यों नहीं डायलेटेड, क्योंकि अगर क्रोनिक पैंक्रेटाइटिस तो पीडी डायलेटेड होनी चाहिए.
जरूरी नहीं है, because what is happening is we can't actually see it between so many vessels. I really can't see it anywhere. अब इसमें आप ये देखो ना, if you look at it here, you have कहाँ गया cursor यार? हाँ, you have you can see acoustic shadowing here, so you have calcification here. And so if you have pancreatic duct somewhere here, it is not necessary that it should be dilated, should it?
That's right, I agree.
Especially in the head, it is quite possible that there is stricturing. That's what we see with chronic pancreatitis. And the tail is gone, so that's the only explanation I have. I tried looking for it, I can't see it. If it was dilated, you don't have to find it. Dilated PD and pancreatic ducts are easy to, in fact they come and shout at you themselves. It's when they are not dilated that you're struggling to find. So this is what I feel. I don't know, Riyaz, you agree with that? This is the only area that I find abnormal.
Yeah, that's right. That's the only area that we can say that it's abnormal.
And I can't go beyond, so we are stuck in this sense that this is the only place we have.
So are you going to do FNB?
I am going for FNB.
22 gauge.
The problem is I am in the stomach. And so I'm going to try and see if I can get. I just want to go where the stent kind of. Okay. Doppler, please. Take this off. Doppler once again. क्या दोबारा यूज हो रही? हाँ? So what I'm going to do is we tried pushing the needle, advancing the needle, and it wasn't going very smoothly. So what I generally do is I will get the sheath out just to make sure that it's clear. You can see it on endoscopy, on EUS, the sheath coming out.
Yes,
I
we
just
can
pull
see
it
that.
back there, Now I'm going to try and reposition myself and see if we can.
Do you keep the Doppler on throat?
No. I'm just for now. बंद कर दो. Can't see the needle yet. So we are deep into the thing, but I am losing. I need to reposition myself. Difficult to maintain the position. हाँ थोड़ा सा मुझे पकड़ना पड़ेगा स्कोप को पकड़ो ठीक है Yeah, that's fine. It is hard here. So I've done 4 or 5 on each side, and I'll try and see if I can change a little bit. That's it. You follow the stent up to here. That's the duodenum. You can follow the stent all the way here. This whole area is hypoechoic. Pancreatic duct. Doppler देना. Flow. No, that's not pancreatic duct. I don't know if that.
ऑफ कर दो
हाँ नहीं हाँ ऑफ कर दो. यहाँ पे I'm not sure. You see that? There is a duct here.
Yes, we can see that, yes.
That I'm not sure, but because that's on flow, it's a ductal thing, but that's all I could see. Nothing more. I think we should have enough sample there. I've taken more passes than I normally do. आप इसको देखें. एक मिनट देखें. टिश्यू है? हाँ? आ गया टिश्यू? कैसे बता? स्लाइड नहीं, मुझे टिश्यू चाहिए. है? निकाल दूं बस? Okay, we're done. So you come back to. So Riaz, we've got nice tissue there. एक
Okay.
minute, so this is good. इसको देखेंगे क्या है? That's a vessel. When you've got a lot of varices, when you have chronic pancreatitis, I find EUS really not much helpful, except for going for a mass and taking biopsies. Other than that, really you're lost because at least I can't make head or toe out of it. Yeah. So we come back. Just come back to the mediastinum and let's. Our sample is very good. Got a
Okay,
nice
wonderful.
5 centimeter core.
Wonderful. That's
So-
brilliant.
So let's see what that shows. What I will do is I'll make sure that we send the histology जो हमने की है उसकी जो हमारे पास formal report आएगी ना, we'll share it with the faculty and the yeah, keep coming.
That's wonderful. Appreciate
Clockwise
it.
थोड़ा सा pull back. Yeah, keep coming. So you've got area 7, right? Big wheel, tip up, air out, and advance a little bit. Yeah, that's it. So that's left atrium on the left. ठीक है. Left atrium here, pulmonary artery here. This is the area 7, okay? Or subcarina. Now,
Now for the arch.
yeah, she's getting a little restless. तो देख लो. When you're doing AP, just इसमें lymph node है क्या यार? दिखाओ. हाँ, there is a lymph node. इसको rotate करो. थोड़ा सा. Yeah, clockwise.
Yes, sir.
So you see there's a slightly biggish lymph node there.
Yes.
ये कहाँ पे?
ये नहीं वही सब कराइना में. So थोड़ा सा रोटेट करें. क्लॉक एंटी क्लॉक अंदर डालें. और थोड़ा एंटी क्लॉक.
Yes,
या क्लॉक. Yeah. Now do anti-clock.
Anticlock.
Yeah, anti-clock. I think there's more than one. तो वो लग रहा था वहाँ से इतना. It's bigger than what you see, right? But looks like an inflammatory one anyway. So how often do you see these lymph nodes that are slightly larger than the expected one? निकाल दो. हाँ.
It's variable. It depends upon the underlying condition.
No, I see. Just when you're doing your endoscopy where you don't expect subcarina, slightly larger lymph nodes, inflammatory looking lymph nodes, we see them not that infrequently.
Not all that uncommon.
Yeah,
Especially
not
in the
that
winter
uncommon.
season when the lots of flu season going on, lots of flu patients. We do come across lymph nodes, roughly about 0.7 to 1 centimeter in size, benign looking.
Yeah. So in this, the problem is the reporting. So I mean, generally, what I would write, and I would like, if there's anything you want to add, I usually would go in straight to the CBD stent scene. Air we saw, so there is patency, thrombosis at the distal end of the CBD, hypoechoic, ill-defined area seen in the head of the pancreas, distal end of the CBD, FNB done, good adequate samples obtained, pancreatic duct, question mark, seen in the head, lots of calcification and features of chronic pancreatitis seen, no tail and body of the pancreas seen, and then portal vein appeared thrombosed, small lymph node seen in the subcarina looked inflammatory, review with biopsy. That's what I would generally report. Would you add anything more or what?
I think you have given a very comprehensive, nice report.
Okay, so good news is that I finally got a patient who has got abdominal pain.